Hi, I'm Matt, and welcome to the Strong and Healthy Rehab channel, a place to discuss all things rehab. In this episode, we are going to discuss the home exercise program, what it is, why we give you one, and why it is important for your rehab and your recovery. So what is the home exercise program? Well, just like the name says, it's a program or a list of exercises or activities that we would like you to continue doing at home. Now, you may be asking, why are you giving me things to do at home if I'm already coming to see you for my rehab? That's a very good question. It's a very valid question as well. Well, it's to continue with the rehab on your own over a longer period of time. Very often when you come to see a therapist, you may be spending 30 minutes, 45 minutes, an hour, maybe a little bit more with a therapist 1, 2, 3 days a week. And during that time, we can make progress with you and, improving mobility or improving your strength, decreasing your pain. However, there is a lot more time that you spend away from us. And during that time away from us, things can happen to kind of regress you. This is something the body does. So take, for example, like a loss of motion. So a joint or a muscle is very tight. While during your therapy, we do loosen it up through our different techniques and things that we do. But if it's another 48 hours before you come back in, that muscle is just going to start getting tight again. However, if you're doing something at home in that time between seeing us and the next time that you see us, it can help you keep those gains that you make. Your therapist will typically give you a home exercise program at your first visit. And if not at your first one, at least at your second one. Now, the things that are on that home exercise program are activities or exercises that they determine are going to work on those things that they found during your initial evaluation. If you are curious about the initial evaluation, I will link the video down below in the description. But during the initial evaluation, we are taking measurements, doing tests, things like that, to get an idea of what is causing your problem or the issue that you're dealing with. So what is causing that pain or that loss of motion or that loss of strength? And once we determine that, that's how we base our treatment on. And from that treatment, we come up with the exercises or activities that we are going to utilize both during your session and come up with things that we would like you to continue with at home, the home exercise program. The home exercise program is very important to your overall recovery. Now, we do get information from you doing those things at home. It's just not a list of things that we want you to do just to fill up some time or just to be more active. Well, yeah, we do like when people are active, but like I said, we do gather information from it. And I can guarantee you one of 3 things will happen if you do your home exercise program. The first, you'll get better. That may seem kind of silly, but that's honestly the truth. Many people, when they do their home exercise program, they do have a response that is positive, as we say, that they start to feel better. And if you come in at your next visit telling us, hey, I am feeling a lot better or I'm seeing some improvement, that means that the things that we found during your initial evaluation, along with the treatments that we are doing or the exercises that we're giving you, are effective in treating those issues that you're dealing with. The second outcome is that you are no better or worse. You're the exact same. That can happen. It doesn't happen to a lot of people, but it does happen. We will ask you a few questions if that comes up. Things such as, did you do your home exercises? Yes, we are going to ask you that about every single time that you come in. If you tell us yes, we may ask you to demonstrate those exercises for us. The reason why is that we want to make sure that we explained it to you correctly and that also that you understand. Sometimes that happens, we don't explain it correctly, or maybe on the sheet that you get, it's a little confusing. And so you were doing them at home, but maybe it just wasn't quite right. That's perfectly fine. We'll go over it and review it for you. And again, at the next visit, assess. The third outcome is, you probably guessed it, you're worse. Well, I will say this is a very small percentage of people that come back that say that they're actually worse with doing their exercises at home. We again will ask some clarifying questions. One such as, are you doing them at home? Can you demonstrate them for us? Because again, maybe they weren't done correctly, and that can be the reason why that you're feeling a little worse. We may ask you to tell us how you're feeling worse. Sometimes, again, people can experience new sensations such as soreness or aching, and it can be completely new and a little scary. By all means, I completely understand that if you start to feel something new. We may say, oh, soreness is to be expected. That's a normal response. It will go away in a few days. Or if you come in saying, hey, I have more swelling going on, something like that. Okay, maybe the exercises we gave you were a little bit too much and it just made it, kind of irritated, and we have to back off. Now again, it could be as well that it flares up your symptoms. It makes your symptoms worse. But that does give us good information as well. It lets us know that what we thought it was initially may not be it, and that we need to change up your treatment and the things that you do to help you in your rehab. There are a couple important things to remember with your home exercise program to get the most benefit out of it. First and foremost, and this is probably the biggest thing, is doing the home exercise program as instructed. Now, the exercises and activities that you're given on there have a specific frequency and a dosage. If you want to think of those exercises or activities like a medication that, if you're sick, you go to your primary care physician, they give you some medication and they tell you, I want you to take this medication every 4 hours for a week. We do the same thing. We're going to give you these exercises. And for example, we may tell you, I'd like you to do this exercise 3 sets of 10, 3 times a day. With that medication, going back over to that example, you wouldn't take all the medication for the day first thing. You wouldn't wake up in the morning and say, well, if I take all the tablets today, first thing, then I don't have to worry about it the rest of the day. You wouldn't do that. And likewise, you wouldn't get to the end of the day and say, oh no, I forgot. Let me just take a day's worth of medication at one time. You wouldn't do that either. Same thing goes for the exercises. If you try to do them all at one time, they really lose the effectiveness of it because our body needs that dosage of it, which is the number of times, like the sets and repetitions, at a certain frequency. For example, 3 sets of 10, morning, afternoon, and evening. The second important thing to keep in mind is to please not add or take away from your home exercise program. The exercises and activities that are on that program are individual to you and your condition. So again, based upon that initial evaluation of what we found is what led to us putting those exercises or activities on the program. I completely understand that sometimes people will say like, well, I found these other things through a search online or looking on social media, or maybe somebody said something about something to do for some disorder. And they say, oh, well, let me add that into the program. An issue that can arise from that is that it can change the outcome. It may be something that actually aggravates your symptoms or doesn't really help your condition. And that if we don't know about it going into that program, again, we could get a different outcome. Likewise, taking away from the program can change the outcomes as well. Completely understand this as well. Sometimes there are just certain things we just don't like. We don't like an exercise. We just don't like something. So it's like, I don't really like this, so I don't want to do it. However, it may be one of the things that they really, really want you to focus on. It could be the biggest thing that could help you. And if it's not in that program, again, it's going to change the outcomes. A third thing to keep in mind that goes along with the last one is not to modify the exercises or activity that are on the program. Again, sometimes something can be seem a little bit too complicated, or if it's like, hey, it may be easier to do it like this. But again, if it's changed, if that exercise or activity is changed, it could change the outcome. So for example, we may want you doing something standing up, but you can say, well, I like sitting down for it because it's just better to do it sitting down. Again, we may not get the same response. Now, I will say with both of these, if there's something that you find in your program that is difficult to do, or maybe that you have heard about something, talk to your therapist about it. Just let them know, hey, this type of exercise kind of bothers me. Can I do it sitting down? Can I change it up this way? They'll let you know to say, oh, yeah, that's okay to do. Or if you happen to have found something in your program, let them know as well, hey, I found this. Should I add this in? Can I add it in? And they'll talk to you about it. Let you know what, we're going to add that in later down the line, or no, we really don't have to focus on that because it's not going to give you a good benefit. So before you try to add or take away or modify, talk to your therapist first. A fourth thing that can be very important and to really help you with sticking with your home exercise program is to have a place to do it. I know it can be very easy to say, oh, I'll just do it in the living room, or I'll just do it over here. However, there could be distractions. Think about what people say about a bed. They say you should have your bed only for sleeping. If you turn your bed into somewhere that you work on your laptop or watch TV or eat, you start associating your bed with many things rather than that main thing that you want to do. Likewise, another example could be that why people don't have exercise equipment at home. They say, well, if it's here in the house, I'm not going to do it. But if I get up and I go to the gym, I know I'm going to do it. So an easy thing to do is find a place in your home that you're going to say, this is going to be my area that I do it. And typically it probably be somewhere that you don't go as often. So you don't want to really do it in the middle of the living room or in an area of your bedroom that you already may associate with something else. A fifth thing that goes along with the last one is to be purposeful with those exercises and activities. Again, very often we sometimes just want to get through it. I'm just going to do all these things and just be done with it. Well, that could lead to somebody going too fast with doing their exercises, their form breaking down, and they're not getting the full effect of it. So again, if you go to your place where this is my place to do my exercises, I'm really going to be purposeful and focus on the activities with them, it's going to get a much better result. And lastly, progressing your home exercise program is very important and can really help you. Now, you don't have to worry about it on your own. Often your therapist will say, hey, I want you to do this. I want you to add this. I want you to use more resistance with this one, things like that. I will say, I will be honest, sometimes it slips our mind. We may forget, because we're seeing so many people, we may forget to tell you to progress it. But if you happen to notice that maybe your exercises aren't getting the same effect as they were before, they're getting a little easy, you may not feel things like you once did, talk to your therapist to say, hey, should I bump this up? Should I do more reps? Should I get more weight or more resistance? And likewise, sometimes your therapist will take away exercises because the exercises they had you doing in the beginning were more of a beginner type thing, and they want you to progress to something a little bit more challenging. So if you do notice that, hey, I'm really not getting the same thing, talk to them to say, hey, should I do something else? There you go, everyone. That is the home exercise program. That's why we give it to you. We want you to continue working on those things at home. and that it is very important to do them, because any therapist will tell you that typically the biggest thing that separates people who do well with their therapy compared to the people who don't is the ones who do very well did their stuff at home as well. And if you ever have any issues with your home exercise program, if you're ever wondering about anything, you see something, you hear something, or again, you're just having trouble with it, talk to your therapist to let them know, hey, should I keep doing this stuff? I'm having problems with this one. I don't really like this one. I don't feel this one. Should we change it up? We're always happy to talk to you about it, to modify it, because ultimately we want you to get better. Thank you for watching the video. If you liked it, please hit that thumbs up. If you have any questions or comments, always happy to answer them. Drop them down in the comment section. And of course, if you enjoy the comment, please subscribe. I'm going to try to put out as much of this information as I can because I want to keep you strong and healthy.